again, mostly for hepatitis C, the evolution of treatments for hepatitis C has happened more rapidly than we would have anticipated. We had years of treatment, no treatments, and then we had interferon, and then various iterations of interferon treatment. But the new drugs are like a miracle. These have virtually no side effects, and they cure 90% to 100% of patients. So the issues now are not finding the drug, but getting the drug. They're very, very expensive. And thus far, they've been difficult to access, except for the most wealthy people or people who have very good insurance. So in the developed world, the US and Europe, particularly, access to drugs is the current problem. How to make them affordable. And the other issue is to find the silent carriers of hepatitis C. Many, many people have hepatitis C and don't know about it. So we're now targeting so-called baby boomers, people born between 1945 and 1965, because these are the people who experimented with drugs, and not necessarily addicts, but just people who tried it out and got hepatitis C in the 60s and 70s and are now 20, 30, 40 years out and getting the more severe consequence of hepatitis C. So our goal is to find the people, to get the drugs that are already developed accessible to the people who are found. Now you can find somebody, but you can't afford the treatment. So that's a big problem. The drug companies are reducing prices in countries based on their economic status, so they're much cheaper in other parts of the world. Eventually it'll sort out over the next year, I think, and ultimately we'll start out treating the people who have the most severe disease, those with cirrhosis or a lot of fibrosis. Ultimately, I think everybody will get treated, and that'll prevent the need for liver transplants, prevent a lot of hepatocellular carcinoma. But the third approach would be to develop a vaccine. And this has been very, very difficult. But if we had a vaccine, then this would be made, like hepatitis B vaccine, could prevent the disease, particularly in the third world, and where these treatments are not going to be so easy to administer. So I think that's still a goal, but in most countries will cure this disease away.